Welcome to the Neighborhood Mic, conversations from the heart of the community, where the stories are real, the voices are powerful, and the work is happening right here in our neighborhoods. Brought to you by Safe and Sound.
On this mic, we amplify voices that don't always get heard. We tap into real issues and we highlight the people that's doing something about it. Because at Safe and Sound, we don't just talk community, we connect it and we champion it.
So whether you're tuning in to learn, to grow, or to be inspired, you're at the right place. Pull up a seat, tap in, and let's pass the mic.
Hey y'all, welcome back to another episode of the Neighborhood Mic Podcast. I'm your host, Trell Johnson, and today we have an important conversation that's needed to be had. We have two amazing black queens, pillars of the community, and I would like for y'all to introduce yourself.
Hey y'all, I'm excited to be here. Thank you for having me. My name is Bridget Whitaker. I'm the executive director at Safe and Sound. I'm really excited about the conversation today.
Hello. I am Ericka Sinclair, CEO and founder of Health Connection Incorporated, also co-founder from Milwaukee Black Grassroots Network for Health Equity, also co-founder from Milwaukee Wellness Collective, and together we are Wakanda Wellness 365, and that tells you all you need to know.
Wow. So y'all just talked about two powerful different organizations, right? I want y'all to talk about the role y'all play in them organizations and what made y'all get into the lane y'all in today in this community work.
That's a loaded question, but I'm gonna see
it's
what I can do.
This gonna be a deep one.
I've been at Safe and Sound since 2019, so this is my 7th year. And I always tell people I have a love for Milwaukee. I've never lived anywhere else, and so much of my career has been focused on making people better. In 2019, I feel like I had a midlife crisis, and I was like, I really want to do something that keeps my adult children also loving Milwaukee. And so I joined Safe and Sound because I felt like the mission was really focused on this idea of how we create neighborhoods that are places that people are thriving and living well. What I remember growing up on 12th and Locust. And so today our mission at Safe and Sound is about uniting residents, young people, community resources to build neighborhoods that people like and want to be a part of. I think that mission is important to me because it really focuses on this idea that nobody is doing it by themselves, which is why I'm really grateful to be joined with our partner here today, Ms. Ericka, because I think that there is this idea that we are safer and stronger together. And so even when our missions may look a little bit different, the end goal is the same. We want people to be well. And I think that there are so many ways to arrive at that there's just opportunity for us to be working together all the time.
That was powerful, wasn't it?
Yeah.
And it's true. And I love the way you came to it from, like you said, what was going on with you and how you even came to the work for real. I've been doing, having my clinic since 2015. And I didn't wake up one day and be like, I want to have a clinic. That was not on the radar, I promise you. My background is in African-American studies, clinical laboratory sciences. I'm a microbiologist and international public health. So I thought I was going to be traveling the world the rest of my life, because I worked for the Centers for Disease Control and I did infectious disease. So things that you hear about now with hantavirus and Ebola and things like that. I was investigating those things in other countries, in Rwanda, Uganda, and Kenya. So I was on the ground doing that work. I thought that was my life work. And then I got married, I had my child, and I was like, he needs to know his family, because I come from a big family. We're everywhere. We're everywhere in Milwaukee. We are Milwaukee. And so I was like, and we were in Atlanta at the time for 10 years. And I said, let me come back. I want him to know his family. So I really came back because of him. And to your point, I wanted him to know his family, but I wanted to understand Milwaukee has so much value. It's so much richness here. And I love Milwaukee, like you said, with all my heart. And I also know that Milwaukee needs help. But it's also a change in the guards that's happening right now. People are getting older. People that, my grandparents used to know, my parents used to know. They're getting older, they're passing. So we are the next ones to step in to make sure that everything really happens like it needs to. So next up, hey, coach, put me in. Right. And so that's 100%. What's happening now. Coach is putting us in. And having a clinic was natural for me because I always did healthcare administration. I don't even know how that happened, but I always knew how clinics worked and what they could do better. So I worked in major hospitals here. I worked in major FQHCs here, community health centers. And when I worked for the health department. I ran their HIV division, and some of the barriers I saw there, I said, oh no, I want to make sure that I can remove those barriers. Timing, if you want to talk longer to your provider, things that you just need, that just make sense, all the sense in the world. But then you don't have to have, money attached to it in that way. So we've been doing this for 2015. We're a free and charitable clinic. We're a hybrid, so we also take insurance. So that when people get insurance, we want them to also be able to stay with their provider. Because if you're in a free clinic, then once you get insurance, you got to leave.
Right.
That's hard.
Yeah.
That is hard. So we created a hybrid just to manage that kind of thing. So as a clinic, we think health is everything. So we're outside more than we inside, real talk. We do a lot of community work. So this is why being with Safe and Sound, especially for June 6th, it makes sense to us because we're about my family's love language is feeding people.
Wow.
It's feeding people. We will cook for you. I won't cook for you. I will buy for you, but I won't cook for you. I'm going to send you a plate. I'm going to get Uber to send you something. But I'm not, you ain't child. But my Aunt Brenda, please. Everybody probably has eaten her food in this whole city. I promise you. If you ain't ate her food, you eat my grandmother's food. So we feed people. And so this is why I was like Hunger Task Force. Like whoever else needs to be, you need to be here on June 6th so we can make sure that people eat. So connections.
I love that. Bridget, I got a question for you. You said you had a midlife crisis, right? Well, I don't know if you want to. I don't know if you want to get deep into that, but in that you chose to get in the lane where you gotta put, like you're an executive director for a nonprofit, right? And the community work, what you're doing is you giving yourself every day. So talk about what made you want to accept the role to where you have to give yourself, knowing something you went through before.
Well, one thing I always say, I have to trust God's direction for my life.
I love that.
And I think that sometimes that's easier said than done. Just like you said, you thought this was going to be the dream. I really thought I was going to be Claire Huxtable. I tell people this for real. Like, I went to Marquette. I was like, I'm going to be a law student. I'm going to live in Brooklyn. And God was like, that's cute. You're not doing that. And I never ended up leaving Milwaukee. And so I spent the bulk of my career, almost 20 years as an HR professional. Okay. So still serving people, still being a cheerleader for organizations. But I felt like God kept saying, there's more for you that I need you to do. And my mom would say, I left a good job. I have been working 10 years for the same organization as their HR director. But there was always this idea of how do you give back? How do you extend more? How do you put yourself in a position where you can help more people? So there's scripture that says, Lord, increase my territory. And I remember praying that prayer, not knowing what I was really asking for. And so I gave notice to my job. I did not have a plan B. They're like, where you going? What's the next step? And I was like, I'm not sure. But I knew God was calling me to do more. I started an HR consulting company, QB Solutions, which I still operate today. And I still struggled with this ain't it. Like I felt like God was like, nope, I need you to do something else. And I actually took a job at Safe and Sound as a program director, which in a lot of walks of life was considered to be a step back.
Right.
And so people like, you went from being this, VP of HR to the program director. But I trusted God. God was like, this is where I want you to be planted. And immediately I saw a need for just serving the people. I had no ambition on being the executive director. And the executive director at the time, I think I had been there for 5 months. And she said, okay, I'm leaving. And so I think you got it. And I was like, no, I'm here for the program director. But God knew. Yeah. And so I said, oh, no, I don't think this is my calling. I don't think this is what I'm supposed to be doing. But she said, I see the way that you connect with people. I see the way that you lead. You are exactly what Safe and Sound needs. And I didn't believe that. And so I remember, I applied for the job. And fun fact, I didn't get the first job opportunity to be the executive director of Safe and Sound. They told me no. And I could have took my ball and went home and said, well, I can't be the leader. I quit. And God said, stay planted. And so pandemic hit. And I ended up being the deputy director of Safe and Sound at the time. And there were so many ways that I needed to lead. I needed to help people. I needed to come up with a plan when there was no plan. I needed to realize that sometimes you have to pivot in order to be able to continue serving people. We were safer at home, but we were like, I got to keep people employed. I got to keep people connected. And then ultimately, the opportunity came back around and God said, now you're ready. But I felt like it was a midlife crisis because I didn't know what was happening in my life, but I knew that there was a need. Like you said, I knew our city needed better. And I just trusted the plan. I always believe that I want to live a purpose where God is directing me in a way that says, and here's what you need to do. And sometimes I'm not even going to be faking. I'm like, Lord, this assignment is long. Clearly there's something else for me to do. And He's like, no, I'll let you know. There's more work. And so I think trusting that plan, especially when it comes to serving people, you have to be selfless. You have to say, it's not about me. It's about where I can show up in a healthy way.
I love that. I want to ask you one more thing, Bridget, and I tend to do this a lot. I'm going off script, y'all, but I'm huge on giving people their flowers, right? I didn't really know nothing about Safe and Sound. Shout out CJ. And he's really, when he got a vision in his mind, he's pushing it. He like, man, you should apply for Safe and Sound. I'm like, bro, all right, I apply. I just did it to do it because he was on it. Then I went to an event. And I'm going to be honest, Bridget, I'm big in my community. I was doing stuff by myself, and I was supposed to work for an organization before Safe and Sound, but it fell through. And Bridget, you was the first person I felt like chose me in that moment of my life. You was like, no, we want him. I was walking around the event, CJ was like, this my mom. I'm like, oh, why you didn't tell me that was your mom? He never told me that you was mom, but he was like, oh, this my mom. And I was like, oh, hey. And he was like, yeah, we want him. Interview him next week. And I'm like, wow. So when you get on camera and you get on stages and you talk about giving back and all this and that, this is proof that you really do it. And I want to say thank you. You mean a lot to the community. You mean a lot to me. I'm new with the Safe and Sound stuff, but Bridget will always tell you this, you somebody I can go to war with. You really get in the field and really do the work. And I just want to give your flowers on that. Sorry.
Thank you, honey. Thank you so much. Shout out to my baby CJ, who's living his best life.
Sure.
Not in Milwaukee, but still doing a great job. But I mean that, Trail. I think about you. I think about Brother Tony behind the scenes here. I think you just see something in people where God is like that's a part of the work. And I didn't know you. I think I saw you at an event, the Emergency Gun Summit.
For sure.
And I remember you were part of a panel. And so interesting, we're saying this thing next up. His business is next up, or his pop-up is next up. Yes.
Pop-up shop.
That's why I laughed. I'm like, yes. But this idea that sometimes our elders who we love and we cherish, we forget that we have to create space for the next generation. And sometimes that's through mentorship. Sometimes that's through coaching and helping. Sometimes that's an employment opportunity. But also being open to the idea that how do we help people who can't always advocate for themselves? And that's why I love the work that you do at Health Connection so much, because it's the idea of I see there's a need, and sometimes how do I bring you with me to be a part of that? And so Trell, love you, respect all the work that you're doing, but it's really God saying, yep, do that too, him too, her too. And I think that that's a part of the work.
I appreciate that. I have to go. I didn't know the clinic. I didn't know about the clinic. I want to salute you for that. Really, what I want to say is you hit the people right where they need to get hit, right? I heard somebody say you start in the crib, when you talk about feeding people. Yeah. That's so important. Yeah. That's the smallest thing, but it's so needed, because how can I come and be my best self at school, at work, at a program if I'm hungry? Yep. You can't. Let's talk about how did you know that was important for you to attack, and how did you push that with helping people from the smallest things?
Mm-hmm. Thank you for the question, because this is important. A lot of things that I do is because I learned it growing up. Even the design of the clinic. We grew up, and I say we because we was always at grandma's house. That's back in the day when grandmas was grandmas. Like that. Okay. Grannies. When we all the grandkids, she's like, drop my kids off. And we were just always there. We were always at grandma's house. So, in both of them, actually. 28th in Chambers, 25th in Juneau, 14th in Juneau. We lived. Okay. So, so some of the stuff we grew up with, when something happened, we went to Sinai. We didn't know that there was a primary care doctor situation. We didn't know that. And so it wasn't until my parents made sure that I grew up in a middle class situation. Now, they grew up poor, but they made sure we grew up, like you said, my parents was at jobs for NPS for 38 years, Allen Bradley for 40 years. So when they were looking at me, it's like, what you doing?
Right.
You keep moving. What you doing? What you doing? Girl, you okay? I swear, I thought my dad was gonna commit me because he was like, girl, you do big things, but you like do it for 5 years and you're done. So he didn't get that. So when I was at Sinai and I was managing the internal medicine clinic there, I put somebody in the emergency room that was from our front clinic, the clinic I was running. I said, I'm putting somebody in the emergency room so that they can direct people to primary care, because people don't know. You get insurance, right? Nobody tells you how to use it.
Wrong.
And there's a lot of people that make money off of us not knowing how to use it. So my goal is, so the surface thing is people need care, right? Mm-hmm. But I have deeper things happening. That's why I had to start these other organizations, because really I'm on a mission to tell people how insurance is supposed to work and that they can use it, especially if you're paying for it. Even if you're not paying for it, like you got Medicaid or something, so what? You still need to use your insurance. You need to know how to use it. And so you can be effective about how you use it, because these are your resources. And some of this stuff you can get food. Some of this stuff you can get gym membership. Some of this stuff, and you don't know these things because people aren't telling you. So now I have insurance companies coming to me saying, hey, can you help me with my population to tell them how to do this? Yeah, because you didn't live this experience. Most of them are not black. Most of them are not from Milwaukee, that the executives that do this work and administer these programs. So they don't even know how we function or work. So then I become an opportunity for them to do that, to teach. How do you teach people how to do this that never knew how to do this? Because you designed this on a piece of paper. Mm-hmm. This needs to happen in the community. So we're translators. Wow. We end up being translators in the middle about how this should be working. And then that helps us be advocates, not only for the people to get their services, but also with legislators. We need this, we need that, funders, we need this, we need that. But during COVID, we were the only ones open. Health Connection stayed open. We never closed. We were testing people in duck suits. We didn't know what we was dealing with either. But we was like, I don't know what this is. But I knew from the work I had at CDC, because I did infectious disease at CDC and with Ebola, hantavirus, and avian flu. I knew what I needed to do. So I got my staff. And to your point about soldiers, I had some soldiers. Shayna Brown being one of them. She was my person. Shayna was like, what we doing? And I was like, okay. Yeah. You ready? Yeah. She was like, oh, what we doing? Between her and Linda West, who was our nurse practitioner at the time, we got out there. And we were testing people, and the health departments closed. Everybody closed. And they were starting to call us. They were like, hey, you still open? Yep. Okay, can we send people to you? Yep. We have people coming from Illinois to get tested. And there's some people that got tested every week. And even now, I talk to people, and they're like, I used to come to Health Connections every week to get tested. I was like, really? Yeah. So people really remember that. I didn't, I was just working. Mm-hmm. But we had a tent that the health department, North Shore Health Department, shout out to North Shore Health Department, they gave us a tent that fit 6 cars in it that people can drive in and do testing. So we had that on Port Washington. We had it in Lincoln Park, and people just came through. So I appreciate that. The foundations that came through to help fund us while we were doing this, because we paid people. Employ Milwaukee sent us 40 people to come through. We employed people during this time. But we were just doing what I knew we needed to do to protect our community. But I saw how it just fed into employment, and training, and some of these people we still work with. So it just has its place when you're like really into it. Mm-hmm. So when Health Connection, we started doing the clinic in 2015, I did it to fill a gap I saw from working in these other divisions and these other places, the hospital, FQHCs, and the health department. And I'm like, there's all kinds of things y'all should be doing. But so I said, I'm going to do, I can show you better than I can tell you.
100%.
So here we are. And I'm telling you and I'm showing you, and they're like, oh, and I'm partnering with you. I'm big on partnering with people and not being just talking about it and being like, hey, you didn't do this. You could have did this. You could have did that. And I'm like, you know what? Let's work on this together. Let's do this further. So that's why we're connecting like 100%. We are. But we always, and she does our HR stuff too. So That's the other connection we have. Because I'm like, how did we do this? And she's like, oh, this is, so it's just because she's practically doing it, we trust her. Because she's doing it. Like the stuff that we're dealing with, she's also been dealing with it. So it's not just the HR, like, you can't chat GPT everything.
No. I wanna first of all, I love y'all bond. You keep saying a word that keep clicking in my mind. Partnership. I never seen. I've been doing the interview stuff for a while. I never seen nobody like come together like y'all coming together. It's genuine. It's love, and I can see it. I want to talk. I want y'all to talk about y'all relationship personally, and then in the community world, and then talk about the partnerships because your organization. That's all we do at Safe and Sound. And you talking about how these partners that came in and helped you with tents, funding, all this and that. Let's talk about the importance of partnerships and good relationships with people in the community.
Sure. First of all, I say this publicly. I love Miss Ericka. She always like, why you say Miss Ericka? Because that's how an endearment, a term of endearment. I grew up with people who were really focused on this idea of, love people because that matters. Not just growing up in the church, but in community. You love your neighbor. You love the people that you work with. I don't remember how we met, which is interesting. I assume it was Ericka Sinclair. So shouts out to my soror if that's who, right? Look, the Sinclair name everywhere. Yes. But I think that it's always about like how do you build relationships that are feeling like not just genuine and meaningful, but always like, you pour in my cup, I pour in your cup. And as much as I, feel like I offer a service to Health Connections, I feel like I soak up the wisdom every time we're together. Mm-hmm. And so we have a formal meeting, but we end up talking about something completely different. And so I say that, Trell, to say I think that there is just a strong importance of making sure that you are finding, like, how do you help people not just realize their purpose. And so I love hearing the story about the creation of Health Connections, but also this idea of like, how are we doing this together? And I think that sometimes that's where people get stuck because it's my, 100%. Crabs in the barrel mentality. I'm the only one that could be over here. But shouts out to funders and partners and folks that get it. And it's like, I don't want to just create a seat for myself at the table, but how do I help other people be connected at this table? Because I think that if our mission is really about serving others, we want everybody to be able to win in that capacity.
Absolutely. And that does matter. Partnerships is everything. We can't do it by ourselves. Funders are important, and they're a part, though. They're not the whole thing. And we do partnership real deep because we have to in order to get this work. Now, we're doing deep work, so we can't do surface. And so I read a caption today on my way here that says something about people that aren't genuine can't stand to be around me, and that's good because you can't. You can't even do it.
People don't like the light if they are living in darkness. And so almost your light irritates me. Yes.
And that's why we have her for HR. Because you just can't do it. When you get with me, you're going to work, first of all. And I mean everybody. But you also going to do meaningful work. And it's not going to be surface. You're not just dropping off that lit. You're going to have a conversation with people about why this is important for them to come to this event on June 6th and other ones as well. So it just becomes that the partnerships have to be deep, they have to be multifaceted, and they have to be genuine. 100%. And that includes the funders. So the funders I've had conversations with funders. So I'm happy that you're having the event tomorrow on philanthropy because we've had to have conversations with funders that didn't get it. And we had to let them know at the risk of them not giving us money. But we had to say it because I'm definitely in an age and stage in life where I have to say what I got to say now because I might not get a chance to say it again. And you may need to know this, if not for me, then for the next person. So that's my whole life mission. And this is God calling. So there's no way that I would be doing this like on human paper. This makes no sense. None of the things I do ever have made sense. But I trust God. So even all these degrees, my mom was like, what you doing, girl? You just I'm like, he telling me to do this. She was like, okay. But and now when COVID hit, every degree that I had came into play. Wow. Every single one. Wow. So, purpose.
So with this podcast, we usually talk about monthly topics, right? Last month was Sexual Assault Awareness Month. This month is mental health. I have to tackle this because this is very important. First of all, what do mental health mean to y'all? And also, when you think of community work, what do you think when you think of mental health in the community work? Okay. As leaders, because y'all both are leaders in this.
Yeah, and that's the whole thing. To be a leader in this, to be, okay, I'm breaking down. To be a black woman in America, in Milwaukee, at this point in time, politically, clinically, psychologically, all the things, it all comes together under mental health. You have to be able to hold yourself together. Again, I'll just be public. I'm going through menopause, and this is no joke. And this forces me to show up in ways, and sometimes that I'm just like, I'm not as together as I would be if I weren't. But it's also real. This is where I'm going in life, and it's where I am in life. And I'm not the only one. There's so many other people that are also going through this, and and your mental health does get impacted. It's almost like your body is going against what you know it used to do. And that's with any diagnosis you get. Real talk. If you think of that, you can like, I got to eat different because I got this diagnosis. So every diagnosis has a psychology behind it that has to be addressed. So we have Tamara is one of my therapists. She's a licensed professional counselor that's a part of our clinical staff. We have nurse practitioners, we have an MD, we have 2 nurse practitioners, and we have our therapists, because we have to understand the mental health of it all, of life in general. And also because it impacts whether you take your medicine. It impacts whether you have access to food, if you have access to food, clothing, and shelter, all these social terms of health kind of things. So I would say mental health is at the center and the core of everything we do in our organization, because we have to understand these things in order to have solutions to them.
I think when I think about mental health, it's that idea of like what you hear on the plane, like you have to put your oxygen mask on first. 100%. And so if I'm really living out purpose, I feel like I have to be like, how am I well? Because I can't pour from an empty cup. I can't do what I do as a leader, as a Black woman, as a mother, as a wife, now as a nana, if I'm not well. And I think that for a long time, mental health was like a trendy word. People like, oh, self-care, go get your nails done. Self-care, go get your hair done. And yes, and I believe in Jesus and therapy. And I think I grew up where the church didn't really respect the idea of therapy. And so I learned, like, in order for me to like really be taking care of myself, it's a daily hygiene practice. So like just as much as you shower, bathe, and go to the doctor, but also like what are you doing for your own wellness? And I think that's something that becomes almost a sacred practice for me, because I realize that, you sit in a lot of meetings and a lot of rooms where the energy is not always the best. And so being able to make sure that I speak with intention, that I speak from transparency, like you said, speak truth to power, even if it hurts, and even at the risk of, maybe I'm not going to get this grant, but I'm going to tell the truth if I really care about people. And I think when I think about mental health as it relates to our mission, I know that our community will thrive when folks are prioritizing, like, what do I need? So whether that's food, whether that's this idea of how do I be safe in my neighborhood, it has to start with an idea of how am I taking care of me 100%. So I can take care of the people that I love.
Absolutely. I love that. Powerful. I love this topic because I was thinking of this stuff myself. Like I said it earlier with you, in this field we in, you have to pour so much of yourself into others. So if you ain't got nothing left in you, how can you function? We was talking. You kept talking earlier about an event June 6th. Let's go into that real quick. Let's talk about that.
Well, just as much as May is Mental Health Awareness Month, June is Gun Violence Awareness Month. And so the first weekend of June is always dedicated to this idea of uplifting the importance of, gun violence awareness. We want communities to be safer. It's hot today. We know as it gets warmer, there tends to be a trend of people not being safe. And so Safe and Sound continues to support this national theme of how do you get communities thinking differently about violence prevention. In Chicago, about 13 years ago, there was a teenage girl who was gunned down literally a week before President Obama's inauguration. And so imagine like the climate of what that felt like in Chicago. And there was an uprising of young people that said, we're not going to let her death be in vain. And so Wear Orange Weekend was this idea that this is what hunters wear when they go out because it brings attention, call to action. And so we want people on June 6th, Saturday, June 6th, to wear orange. So there's an opportunity to like bring attention to enough is enough. We want people to stop hurting each other, killing each other. We want to create space to bring community together. Again, we can't do it by ourselves. So we're partnering with Health Connections to have a message of how do we get people thinking about their responsibility, because we're not just calling on MPD or the mayor or some elected official. I would say nobody's single-handedly saving Milwaukee, but we need people to be working together to uplift this message that gun violence is too much in our city, and how do we help people be well, take care of each other, and stop killing each other.
100%.
Yep.
Absolutely, and I appreciate you with being willing to join us and being partnering with us on that day. I called Bridget, I sent her a message, and I was like, can you be a speaker? She was like, well, we actually got another event happening. And I was like, now mind you, I'm driving from Wisconsin Public Health Association meeting, and I was like, wait, let me think. So can we partner today? And she was like, yeah. She's like, I hope you would say that.
I love that.
And I was like, this is great. It's like a big old pajama party outside from a standpoint of like the comfort and the how it fit. Like it just made sense. If you don't have food, clothing, and shelter, then this is where this puts you at risk for choosing gun violence. And so we try to do things to make sure that makes sense to the community, and that made sense. So we already have, I meant to tell you, we have 21 people signed up to be, to do healthcare access, insurance coverage, actual servicing with screenings. They also have information about how to sign up for health clinics and other things. We have a lot of people that just want to help and be in a space where the community, that they're accessible to the community. And so having that conversation with a lot of funders, a lot of other partners is big for us. So we over time have created a connection with people like that. That's like, hey, y'all, get out of the building. Everybody's not going to come in this building. So you need to get out and say, hey, Milwaukee County, we're out here. Milwaukee County has huge, wonderful, deep programs. People don't know about them.
Right.
So we're like, hey, y'all, come with us on the tour. Let's go. And then we get out here, we give them the information. Now they can come in the building because they know they can come in the building. So that's what we're doing now, is really making sure that people have healthcare access. City on a Hill Clinic closed April 3rd, Good Friday. And it's a religious-based organization, so that's why that was important. So we had to really figure out how to make sure that people in Milwaukee knew that they actually had healthcare access. And so we wanted to bring our partners into the community so they can be visible about the fact that they're accessible. And so that's what we do, that's why we had this day. So bringing it together makes all the sense in the world. Health is everything.
And that is Saturday, June 6th, at Safe and Sound. We're located at 4422 West Leon Terrace from 12 to 4. It is free. And just as Ms. Ericka said, so many community partners, so many opportunities for folks to get access to health, get access to information about being safe. We're asking people to wear the color orange. I know you got something in your closet or Amazon right now. You got time. But it's a beautiful opportunity to be together in community. I always say that, when people are together and we're working together, there's fellowship. People learn about, what can I do next? And so we're hoping that people come out and just enjoy, take advantage of so many resources being available.
Absolutely. There'll be horseback riding and free food.
Oh, wow.
Okay.
Right.
Okay. I keep forgetting that part. That's the part.
Because I'm bringing it, and face painting. We have to have fun.
Yeah,
We can't do this thing and just be so serious about it. We need to have fun, and we have to make it family friendly. We have Connect 4, I believe. Like, we got stuff. So come, it's family friendly. We want you to bring yourself, your family, your neighbors. Just come. Be with us.
Man, to end this episode, I want to ask y'all a final question. What is the message you want to do to tell the community about unity moving forward and how to connect like y'all connecting? Just message to the community, to whoever watching, about healing, unity, and partnership.
I really believe that if we are touching and agreeing that the condition of our city, our nation, our world is not where we want it to be, like, we have to be the change that we want to see. I keep saying we can't wait on some entity, some program, some organization, some president to save us, right? So I think that it has to start at home. It has to start with us saying, what is the part that I play? What's the role that I play? I think about this ecosystem of community. There is an entry point for everybody. There's room at the table. Everybody has a gift or a skill or some sort of contribution. And so we got to stop, sitting on the sidelines. We got to stop sitting on the wall. It's how can I get involved? So whether you volunteer, whether you come out and get resources and learn about what organizations that need help, because a lot of us need help. Sometimes it's sowing a seed. You don't have to be a big funder to write a check. I take 100%. A $25 check to pay for these printing things that I got going on. But there's always something for somebody to do. And so the message that I would leave is that if you are in agreement that you want the world to be better, my question would be, what are you doing? What are you doing? How are you showing up? And I feel like if everybody finds a role to play, we'll get to a world where we feel better about.
I love that.
Absolutely. I should have went first. So she can say that because that was a good way to end it. I would say the things that we want people to know is that they do have a gift. And we do have to tell people that. And I would say the people that I think about that really made a difference for me in the way that in me believing in myself, because a lot of things happen because people don't have good self-esteem. 100%. They don't have to get understanding of self-worth. So then they come out and they make crazy decisions that really impact other people. And some people are very individualistic. They don't think about community. And so being able to help people understand that in the moment. I have stopped whole meetings and I was like, okay, hold on. Let me say something to baby girl real quick. Because I may not get a chance to do that. That might be the thing that makes her make a different decision when she leaves the space. And so we need to do this because at church, I have a big family full of pastors and preachers and all this. I got 5 of them in the field right now in Milwaukee. That's not even in Milwaukee. So we grew up this way. We like literally party on Saturday. You better be in that pew on Sunday morning in the front. And you better not drink too long. Okay, so that part. So, but being in a space of somebody telling you your gift. So we need to tell people when we see it, like, hey, do you know you have a gift too? Because people need to know that, and that makes a difference for them. And if you don't do that, I think you're out of alignment. You're not doing your assignment. And I feel very strongly about my assignment. My God assignment is paramount. If I don't do that, I'm in trouble. So I already know I got to do it. So that's the thing, is that making sure that we call people out in a good way, but also call people in.
Ooh.
And saying, hey, this is what you should be doing. I see you out here and you mad. But let's channel that energy, because we need that energy, but we got to channel it a certain way. So how about you come with me to this event? How about you come to the clinic and let's talk through some stuff. Let's figure out some stuff. And we do a lot of free care. Now, we're a free and charitable clinic, but we don't get as much money as free clinics get. So a lot of times we taking L's. That's why we need donors. Because some people need care now. They can't wait until they get to the other place or the other appointment or whatever. They need care now. So we take care of people, and we do help them get placed where they need to go, though. But we got to do this together.
Right.
So that's why partnership is so important. We can't do all the things. We can't see all the people. We can't do our scope of care doesn't go to the point where we don't have mammography machines, but other clinics do. Right. So we'll just, we partner with them. We don't have a dental clinic, but good Lord, how many people need dental? And so how do we get them to the other place? So Progressive will be there. We partner with them around that stuff. So we have to do community at the community level always. I don't care how high we get in our respective situations and positions. We have to always touch the ground. If the ground doesn't feel it, it's not happening.
Wow. Well, that's a perfect way to end this episode. I really want to thank y'all for coming in and having this important conversation. Because here at Neighborhood Mike, we love to have a conversation from the heart of the community. And that's what just was displayed today. Please like, comment, and subscribe to the channel. Please tap into this, y'all. We having meaningful conversations. We not just sitting on this camera talking for nothing. We having purposeful conversations. Subscribe and be here for the next one.
Hey y'all, thank you so much for listening to this month's episode of The Neighborhood Mic. I hope that you enjoyed the conversation with me and our very great partner, Miss Ericka Sinclair from Health Connections. We have been focused so heavy on this idea of taking care of each other, mental health, and the importance of making sure that we check in. And so I hope that there was something that you heard here today that inspired you, that motivated you, that have you thinking differently about how you are well and how you make sure that those around you are well. I hope that you will check out some of our community events coming up. Always feel free to check out our calendar at www.safesound.org. Again, this is Bridget, and this is the Safe Sound Off. Peace.